blind, somebody is blind.
Yeah, for example.
He can't make himself,
Yeah.
he can't maintain his balance.
Balance,
He will
yeah.
try
Yeah,
exactly. So the eye is an important part to achieve the balance.
Okay.
Then we have something we call it proprioception, which achieved by our muscles, our joints, and our skin. Which means if I want to walk and maintain my balance, my muscles will feel that I'm walking, and help me to stay stable. Then the last thing and the most important thing is the central nervous system, the brain, and the cerebellum. Cerebellum here coordinate the function of the previous organs. So, in general, ear, eyes, muscles, and joints, and the brain. These organs achieve the balance. Then, any problem in
Either of them,
the ear, the eyes, the brain, the muscles will causes dizziness.
Okay, so this is what we have over there.
Exactly.
Is it exactly what you were trying to explain to us?
You see these semicircular canals?
Yeah.
You see these small
Doc,
spots?
you can
go closer to it, so our viewers can have a
bit.
better understanding of it.
So, in the ear, we have three major parts. The external ear, this and this, we call the external ear. This is the tympanic membrane. Then we have here something we call it middle ear. Then the inner ear. This is the inner ear. It's responsible for hearing and balance.
Okay.
This, we call it vestibule. And this, we call it three semicircular canals.
Okay.
The vestibule is responsible for, we call it horizontal and vertical acceleration, which means when we are walking straight, we are walking straight, the vestibule is responsible for our balance.
Yeah.
When we are at elevator, the vestibule is responsible. But the semicircular canals, it's responsible for something we call it angular acceleration, which means when we turn our head, when we turning over in the bed, most patients has the first attack of dizziness during turning over in the bed.
Oh.
When they move their head or when they turning over in the bed, they have the first attack of.
And it has nothing to do with you being sleepy or you still maybe in sleep mode?
No, in sleep mode, not sleepy.
Okay.
In sleepy, it's hard to, because the patient should be conscious.
Okay.
Right.
In semicircular canals, we have, you see these small spots?
There's small spots over there.
Yeah.
It's called autocrystals. It's small crystals, like sand. It moves, you see this?
In that direction?
Yeah. It moves in this direction, and with this move, the balance is achieved. So, sometimes these crystals has a wrong location, or it doesn't move quickly. So the dizziness happens, and this crystals is responsible for one of the most common dizziness from ear origin, which it's called benign paroxysmal positional vertigo. This is the most common type of dizziness at all.
Okay.
These crystals are responsible for it. So, since we talked about benign paroxysmal positional vertigo, I just want to talk about it for 1 minute. Benign paroxysmal positional vertigo, it's the most common.
Okay.
It represents as 10 or 20 seconds vertigo. It's vertigo. The patient feels that he's rotating, okay, or the surrounding
is moving.
around.
It has nothing to do with hallucination.
No.
It has nothing to do with that.
The first attack, as I told you, the first attack happens during when he's
sleeping
at bed and turning over.
Then
He feels what's happening.
Okay.
See? So this kind of dizziness is from ear origin, and the patient goes to many doctors, and maybe to 100 doctors, give him medication, and the patient will not be okay. Because this kind of dizziness, we treat it with physiotherapy. We should relocate these crystals to its...
Back to where...
Exactly, to its original place.
So, Dr. Kamal, so I have experienced a situation where I was walking by the poolside, and just looking at the pool, I started feeling slightly, you know, like it felt like, I was moving, but I was just standing there, just looking at the pool. So I don't know if it has to do with the movement of the the way the water was moving.
This could be motion sickness.
Okay.
Oh.
Motion sickness is kind of dizziness which happens during sailing or riding a car or being in a bus.
Okay.
You see? So this called motion sickness. It's dizziness for seconds. Okay. And sometimes it happens with vomiting or nausea. So this we call motion sickness. Another option, maybe it will be eye problem. When you look at something, if you have refractive error, or if you have myopia, or if you have hyperopia, any eye problem may cause dizziness. If we want to talk about dizziness, we can talk for days. Because
it's a lot.
It's not a dizziness. It's not a disease. It's a symptom.
It's a symptom.
It's a symptom.
So you don't need medication for that?
Not of...
After diagnosis, it's not something that you need medication.
If
you need to be... It's a therapy?
That just for benign paroxysmal.
Okay.
If you want to talk about other... We have something, we call it acute vestibular neuritis. Acute vestibular neuritis, it's another kind of vertigo from ear origin. It represents with severe rotational vertigo, with vomiting, with nausea, and lasts for days. So the patient needs hospitalization. He needs to...
It can be worse. It can get to that stage.
I want Doc to help me with my problem. Because, so for a very long time, when I was even in senior high school, my dad would pick me up from school for vacation. On our way in the car, while the car is moving, before I realize, I'm dizzy. Like my head, so I have to shut my eyes for a little while.
During
the movement of
the vehicle, I have to shut my eyes for a while, or I have to let them stop so I can throw up.
Exactly.
That's what he was talking about. No, you get no shit.
That's 100% motion sickness. Okay. This treated by something we call it vestibular inhibitors. We should reduce the function of the vestibule with some medication. We should take it 30 minutes before we riding a car, or before so it will, or before we go in sailing or something.
Driving
okay. Sometimes it happens in the air. So the patient should take this medication. There is something very important to talk about this. These types of dizziness, which from ear origin, we call it peripheral. There is two types of dizziness, peripheral and central. Peripheral, in general, it's safe. It's not dangerous. Okay? Don't lose the patient, he's conscious. But the dangerous type of dizziness is the central type. That could be from brain tumor. Could be from multisclerosis, MS. That could be from migraine. Migraine-associated vertigo is one of the most common vertigo from central origin. So every patient have migraine, he could experience many episodes of vertigo. So we should treat migraine first,
before we move
to
my personal life.
So central reasons are very dangerous. At the end of the interview, I will give some, I call it red flags.
Okay. So when
which
you
means
sleep,
that's dangerous.
Okay. Now let's talk about kids. You mentioned that sleeping and all of that contributed to this. And so if you're a child or if you have a baby and the baby is going through that process, how do you identify that as a parent? And how prevalent is this? Is it something that is very regular? A lot of people are going through it, or it's just a minority few that are experiencing it?
Look, in kids, generally we don't face real cases of dizziness.
Okay.
But we should be aware of dizziness with vomiting.
Okay, so for example, if the baby is vomiting or is feeling dizzy, because we can identify
how old? How old?
So we're looking at 5 years.
5 years. 5 years, we should be aware of eye problem.
Okay.
First of all, okay.
The ear.
Chronic ear infections, okay. And maybe it's a blood problem. Sometimes anemia, low grade of anemia could cause dizziness, okay. But if it happens with severe vomiting, loss of consciousness, we should, this red flag, we should maybe do MRI or CT scan, but not every child he came and say, I'm dizzy, I will do MRI, or we should check him, we should take detailed clinical story and clinical history, medical history, surgical history, comprehensive physical examination for the whole body before we take any decision to do any investigation like MRI. But in general, the dizziness during children maybe happens from eye problems like refractive errors or something like that, especially now with the using of mobile phone and tablets. And you see, this cause dizziness for childs. We see it recently. Before we didn't see it, but now we are seeing that.
So it means that it will be more scary for under 5 years.
Yeah.
How do you even
I was about to say, so it means that technology is even contributing to this.
Exactly.
Then.
Exactly.
That's alarming.
Yeah. Exactly.
Very alarming. So what can we do? As a parent, what could you do?
We should advise them. Maybe we recommended sports, swimming,
Instead of
some activities,
phone.
but not stay, because now I'm seeing when the mother cooking or something and her child start to cry or take my phone and
get busy with that.
Yeah.
But is this something that is occurring, in terms of numbers?
Yeah.
Or it's just a few people that are experiencing that?
Not too much.
Okay. No. So it's not as bad as we probably will be looking at it. Oh,
okay, so I want to go back to my problem. So
it's a special interview, not?
No, because I know that there are quite a number of people. Yeah, one consulting. So I know that there are quite a number of people who are going through what I go through or what I used to go through. Okay, so now that I'm quite older than before, what's happening to me is that when the car is moving and I use my phone, like I'm looking on my phone and I'm just texting, I can't. I have to put it away and shut my eyes.
Did you check your eyes?
Yeah, I have to shut it for some minutes. Then I become okay before it goes away, because it's like my head becomes heavy and it's like everything literally is beginning to spin around.
This motion sickness, it's a simple problem. We can treat it with vestibular inhibitors 30 minutes before you ride the car.
Wow.
That's it. But we can't use vestibular inhibitors for long term. We can't use it more than 2 weeks. Okay. But then we can take a rest, then we use it again.
Yeah.
But check your eyes.
I should check my eyes?
Check your eyes.
Okay. All right.
So it means that now, since it's coming from sleep and it's ear and that, is there a recommended way of sleeping that people can check?
They should move slowly. They shouldn't turn over fast.
Okay, so when you're sleeping, you're telling it has to be slow.
Slowly.
It's not like you turn.
Yeah, that way. Or if your friend call you, you shouldn't turn your head fast.
Immediately.
Like this. It's the
Okay.
same. But then the crystals are moved slowly. But if I do this, the crystals
You're
are slowly.
forcing it,
This, the
yeah.
autoconia, it's the crystal that I'm
Over
calling
there.
Okay,
about.
okay.
I'm talking about. This, the BBV, that what we're talking about, benign paroxysmal position of vertigo. These three movements, it's the physiotherapy that I was talking
Okay.
about this. So you see, the autoconia was here. Then with this movement, we
It goes to that
it's good.
side.
Then this, the right place to come it. Then the vertigo will stop.
Wow. Wow. So this is the therapy process you go through.
Exactly.
Make it
Through
better.
physiotherapy. We call it Ebley maneuver. Ebley maneuver. It's on YouTube if someone wants.
They can check that.
Yeah.
Okay. Before we go, what are the red flags you mentioned that you want to share? For
Red
people?
flags.
Yeah.
Red flags means these symptoms, if happens, so there is something dangerous.
Okay.
First of all, sudden hearing loss. Sudden. If you woke up and you notice that you have hearing loss, this is dangerous. Or sudden tinnitus, especially unilateral, which happens in one side.
Okay.
Okay. Severe headache with the first attack of dizziness. Severe headache. Okay. Inability to walk. If you have severe disequilibrium that you can't walk, this dangerous. Chronic discharge from the ear. Chronic discharge from the ear, it means there is chronic middle ear infection, and maybe it goes to the inner ear and causes a problem.
Okay.
Severe vomiting
Okay.
and nausea. Double vision or blurred vision. That's the most important, and loss of consciousness. Every dizziness the patient can maintain his conscious is benign. But when the patient lose his consciousness, that's dangerous. That means central. That means brain problem. Maybe it's bleeding in the brain. Maybe it's infraction in the brain. Maybe it's brain tumor. So that's a red flag.
Great.
Okay.
That's a lot. That's a lot.
Yeah. Dizziness. It's.
But you see,
can-
it's interesting how we even see dizziness. Everybody thinks it's something everybody is.
Yeah, it's
experiencing,
something.
so it's a normal thing.
Yeah, normal.
That everybody goes to.
Yeah,
like-
it could be something simple like motion sickness.
Yeah.
Yeah.
And it could be brain tumor.
That's scary.
From here to here.
There.
Yeah, that's
Yeah.
scary. Because you might just think it's normal dizziness. By the time you realize it's something bigger than.
How could it be dangerous if we couldn't achieve the right diagnosis?
Okay, Dr. Kamal, thank you so much.
You're welcome.
I'm glad I've gotten. In fact, I'll talk to you after this because I need to find like a proper solution. To
Sure,
the problem.
sure, sure.
'Cause I don't like the fact that when I'm moving in a car after a few hours and then I start feeling
Exactly.
dizzy, it's quite uncomfortable. And so, ladies and gentlemen, still talking on health. You know that as part of the festive season, people being benevolent and doing nice things for people and all that, we have a group of doctors who are willing and ready to help people with spinal problems. And so we are still talking on health. We are going to be seated with Ryan Normando, and he's the president of 33 Spine Align, who will be joining us pretty shortly for us to have a very awesome conversation in relation to what he has for these patients right here in Ghana. And we are still here with Dr. Kamal. You have not sent in your questions, so they have not sent in any questions.
Because they think dizziness is just
Dizziness is a normal.
but
No, it's not.
it's something that
It's
everybody's
not.
supposed to be worried about.
Yes.
Especially when it continues for a while. Somebody might just think that it's a normal thing. It will just come and go. But it's something that we all have to be very, very careful when you experience these things.
Ryan, please join
Always
us.
make sure
Kindly join us.
You are going to the right places.
Yeah.
To check.
Yeah.
Hello.
You're gonna
Come on,
be good.
Dr. Kamal.
All right. Good to see you.
Hi. Pleasure.
Great stuff.
Pleasure.
Please have a seat.
Thanks for having me.
Great.
Thank
I
you
like your
for being
outfit.
here.
Thank you very
I
much.
should be wearing one of these days.
We got plenty for you. Yeah.
Okay, professionally, I'm not supposed to. Maybe, just maybe. I love it.
We'll bring you up to focus.
Please,
We'll
you
get
should.
outfitted.
You should.
Absolutely.
Right, so Ryan, you're in Ghana for a voluntary mission.
Yes, ma'am.
Okay, so you are the president of 33 Spine Align.
Yep.
Kindly tell us, explain to us and our viewers what your mission is all about. Why are you in Ghana?
Yeah, so we had this dream when we were younger to help the less fortunate. You know, how I grew up and where we are today. We put together a group of U.S.-based spine surgeons to help those in need, right? We partnered with Focus Community Hospital here locally through Dr. Brawachi, Prof, as we call him. And then, the dream became a reality over the last 4 years. It's our fourth mission trip. So we raise money in the U.S. and then we bring folks over to administer the care for the patients locally.
Is it the first time?
Fourth time.
Fourth time?
Oh,
Yes, ma'am.
good one.
That's
And
excellent.
you're dealing with one of the most complicated things in the human body, is spine.
Right.
Yeah, without a doubt.
These are very, very complicated issues, you know.
Yeah, extremely complicated. You know, the U.S. team, Sunil Jeswani is here. He's based out of Sharps and represents Sharps in San Diego. And then we have two Duke U.S. surgeons, Melissa Erickson, who's orthopedics, and then Rory Goodwin, who is a neurosurgeon as well. So very complicated. The pathology here is tuberculosis of the spine. It's very, very challenging, and a litany of other things that we have to deal with on a regular basis. But we don't see that in the U.S. often.
Okay.
Why the specification on spinal or spinal issues? Because there could have been any other ones that you want to take up. And
Yeah, great
is it
question.
because of the prevalence here in the country, or it's something that
It's
research showed?
It's because of the brevity of the cases. It's an underutilized and underserviced application because of how difficult they are. So we wanted to go after the most challenging pathologies to help fix that. This is what we do back in the States, so we're all based around it, whether we're in the manufacturing side of it, or whether we're on the science side of it, or whether we're the surgeons themselves. So we wanted to use what our knowledge base was to come over here, help educate, but also be educated as well, because these are some of the most challenging cases in the world.
Okay, so you're partnering with Focus Orthopedic Hospital. So how exactly are you getting people to come on board? And do you have a specific number of patients that you're hoping to work on?
So the backlog of patients at Focus is about 4,000 plus. It's a lot.
Jeez.
Yeah, it's
4,000.
it's a lot. So we're trying to make a dent in that. Unfortunately, or fortunately, depending how you look at it, we can only help about 10 to 12 each week. They have 2 ORs there, so we raise the money in the U.S., we bring it here. The patients pay nothing. We bring the surgeons over, and then we go to work. So each year we try to take 2 mission trips. We came in June, and obviously in December we like to do it before Christmas, the holiday season and stuff like that. Yeah. So. We're working towards obviously developing more mission trips and the outreach programs and stuff like that in the States, but also here locally in Ghana to educate those that may not be aware of Focus, but also 33, and then so onward and upward. But we're past the embryo stages of what 33 was started.
Okay.
And now we're starting to crawl.
Okay, so for how long?
So we're here for a week. Usually we do about 8-9 days because the travel takes so much time, especially for the guys in California. But we'll be here. We usually see, we land Saturday or Sunday, and then we see patients all day yesterday in clinic on Monday, and then we operate Tuesday through Friday, and then we head back home.
I see, that's a lot. So if I'm home right now and I'm watching, which type of spinal issue are we looking at? So when I'm coming, I know, okay, I've got a specific problem that I can be.
Yeah, primarily pediatric scoliosis, curvature of the spine. So, rib humps, back humps, stuff like that. Mm-hmm. That's when you start dizzy, and as involved as parents are over here, they probably know pretty regularly if one of their children has a spinal deformity. And so then, get intervened with Focus and have some intervention early. And then obviously over time, we'll develop a patient care continuum. And then those folks will obviously be sponsored by 33. And with the help of Focus, which is an unbelievable program, an unbelievable hospital system, here that you have locally in Ghana, and then we'll get them the care that they need. We'll either preoperatively, sometimes we have to bring them in from other parts of the country or other parts of the world, and feed them to get them to a certain weight, right, to make sure that they're at a weight for any anesthetic complication, and we'll try to mitigate that. Okay. And then we operate, and then post-op care there is exceptional.
So that's a whole package. It's not as if you just looking at the patient and then it ends there.
No, that's a very fair point. Yeah. It's, you know, in the States, early intervention starts very, very, you know, as soon as birth, right?
Yeah.
So sometimes we find these folks that they haven't seen a doctor,
Exactly.
you know, in a long time or ever, really. So what we like to do is you know, we try to take the highest brevity cases in regards to, you know, their deformity has gotten to a max where they can't really survive anymore.
Yeah.
Right? Lung complications, stuff like that.
Okay.
And so we usually try to put them at the top of the list to try to get them the care that they need. But unfortunately, we're one organization,
Yeah.
right, aware of Focus Hospital. And so my main message is to try to figure out how we can help partner with other facilities and
Okay.
organizations to help get more care here. The people here are unbelievable. You guys have been so accepting, and we love it. And you know, I speak on behalf of my board, all the surgeons. I get emotional about this stuff, and it's very, very, it's great work, and we love it.
How many cases have you worked on so far?
29.
29.
Yep.
Just coming in recently?
Yeah, physically here. Yeah, we've been able to sponsor 29 total surgeries over those 4 mission trips. COVID had other, you know, other plans for everybody, as we're fully aware. But so we had to take a couple years off because we couldn't travel with U.S.-based surgeons, and obviously protocols and policies in place for different countries and stuff like that. So we want to be respectful. But now that that's kind of passed, we're now ramping back up. We've been fundraising all through that time frame, and so we donate anywhere from $100,000 to $130,000 a year now to sponsor these individual surgeries. Each surgery costs between $12,000 and $17,000, so we average right around $15,000 USD. So it's a decent amount of money, but our U.S.-based donors are exceptional, and they've been on board with us since the beginning. We bring back messages, videos, photos. We make it very organic and authentic for those that have the care here, because obviously they can't come with us.
Yeah.
So the messaging, the communication is very high level, and it's very important.
I'm looking at these pictures and I'm seeing
Exactly.
smiles on these faces.
Oh yeah.
And all courtesy you and your team.
Yeah.
And it's really fulfilling, you know.
Hopefully my hair's a little better today.
I've looked at a few and you still look better.
Thank you.
You know, there's a Ghanaian in there.
Yep, that's Dr. Arthur Sakifu, who's an orthopedic surgeon here, exceptional surgeon, great partner. You know, they really have. We've developed a bit of we call it family, like we're coming home.
Yeah.
Now that we've done it a handful of times, and so we obviously are going to do it more. But the team at Focus and Dr. Wolf, Irene Wolf, is in one of those pictures as well. We took a picture yesterday. She's just a phenomenal leader, and the hospital itself is really it's in such a it's in such an underserved part of the world, but the hospital care is exceptional, right? And the nursing staff. I mean, it takes a family, right, and a community in order to bring these kids from where they were to where they're going to get to. And our goal is just to help those the less fortunate stand tall, you know, and develop a level of confidence to help them carry themselves through their life.
What age range are you looking to?
We primarily focus on peds, but due to the fact that like we can't physically get here as often as we'd like to, sometimes they age out into the early 20s. But we're sponsoring surgeries anywhere from, you know, we have a 1.5-year-old roughly this trip, all the way up to mid 20s.
Okay. All right.
Dr. You spoke about cerebral, you know, how we're able to, our nervous system and all that.
Yeah.
Does it have any connection to what Doc is
Yeah, we were talking about dizziness. And vertigo. There is main cause of dizziness. It's the cervical spine.
Cervical spine.
Cervical spine. I wanted to talk about it. Cervical spine, especially in women who has housewives or something, or has office job or something.
Yeah.
The cervical spine problems like disc herniation or, you know, causes dizziness. It's rotational with vomiting, with nausea, with occipital headache.
Yep.
Yeah, it's common cause for, especially at the mid-age, after 30.
Yeah.
Through women's, so it's a common cause.
Yep, without a doubt.
Yeah.
And the curvatures of the spine here are abnormal comparatively to what we see in the States. They're very
Abnormal?
Yeah, they're very progressive. Yeah.
Okay.
And it's due to the fact that early intervention is so important to help mitigate any issues down the line. You know what I mean? We're not here necessarily for a long time, but you know, we want to try to have everyone have a good time while they're here on the earth. So we're just trying to make a little bit of a difference you know, from our landscape and how we, you know, the education that we have based back in the States and try to bring that here. But your team here locally is exceptional. And, you know, we have been a really, really good partner, and they've been an exceptional partner for us. And really, we're learning more than obviously we're teaching here locally. So it's been really, really great.
But we've got plans for 2024.
Yeah, so
probably I'm not setting in now, and hopefully I'm looking at 2024 if I can also.
No, yeah, we have to. We usually plan 6, 12, 18 months in advance. Each mission trip that we're going to take is going to be based in June and December, and that's pretty much cemented now, based off of our U.S. donor pool and then also the partnership with Focus. So we're planning on taking those mission trips. We have a handful of different fundraising opportunities in the States over the next year. We're going to do an engagement out in San Diego in April. We have a golf tournament that we do every August, September timeframe, depending on how the weather looks. And we do that in the state of Maryland. It gets pretty hot there, so we try to you know, mitigate that as best we can from a heat standpoint. But then we have a handful of just small engagements where, you know, we're communicating, we're progressing the mission, we're making sure that everyone's educated on what we're doing. To stay relevant, you know what I mean? Because that communication piece, and I underline that, and then obviously I italicize it, bold it in emails. It's very important to make sure the communication stays at a high level and it's constant, with a lot of quality, right, involved in the messaging. So yeah, we're very communicative back in the States, and then also here locally, our representatives talk all the time. So we have a handful of different engagements for 2024, and then also 2025 we're prepping for as well.
And probably maybe finally in terms of volunteer, if somebody's watching and the person wants to be a part, it's a surgeon or someone just sitting there and saying, it's a good cause, I want to be a part of it.
Absolutely. So we have Instagram, LinkedIn. Instagram is at 33 Spinal Line. So and then you can reach out to myself at Ryan at 33spinaline.com, and I can put you in the right camp in regards to how the infrastructure works internally for us. Everyone on our team works pro bono. So we all have real jobs back in the States, but you know, we're very focused on this and making sure that it you know, it continues to get some legs underneath us. So yeah, if anyone's willing to volunteer, please reach out and look us up online. We have a website as well. You can see some of the US-based surgeons that we've partnered with already. That pool is growing as well. So we have probably 20 to 25 total surgeons that have reached out to us that are interested in coming over. And they're really, really good leads that are they're communicative, they're upfront, they want to take a trip in the next 2 or 3 years. So, and that's really important because as the funds continue to raise and we continue to grow our donor pool, we'll be able to do more mission trips here, right? And so we'll have more US-based surgeons all around the country that are going to be coming here more often than hopefully not.
That's
Pro
great.
bono,
Yeah.
but indeed the world is a better place with people like you.
Well,
I appreciate you.
We're making our small mark, but yeah, we're having a lot of fun doing it too. So I always feel like we're very rewarded when we.
We are highly appreciative for this initiative. Thank you so much.
Without a doubt.
For doing this. Thank you. Okay, so viewers, that's where we have to end this conversation. Yes, you learned so much this morning.
So much, yeah.
So during the beginning of Good Living segment, we've been talking with Dr. Kamal Walid Amer, who is ENT specialist, a head and neck surgeon, and later we were joined by Ryan Normando, who is the president of 33 Spine Line, and something incredible has come your way in this month of December. So yes, just do well to be a part of this if you can.
Yeah,
That's
and continue
thank
to
you.
show love when you can. Be nice to people, be kind to people, because Christmas, obviously, it's time for us to show kindness
Yes,
and
let's
love.
show so much love. And yes, let me use this opportunity to say a huge good morning to you, Robert Coleman. He's watching us this morning. He's the CEO of Wembley Constructions Limited. He's also known as the King of AstroTurf here in Ghana. So Robert Coleman, good morning to you. And yes, maybe later I'll come by for lunch. Okay, all right. So this is where we end this conversation.
There's more.
But yes, we have something little for you, viewers, and so.
And then we'll come out
please
to wrap
stay tuned
up.
for this. Yeah.